So good afternoon. I'm pleased to be here. This is the 1 year anniversary of these podium press conferences. And so that means over the course of the last year, we have come to you around this time hundreds of times to give various updates. It also means that we owe a thanks to the folks here at the City of Memphis Main Library for hosting us at all of these press conferences over the course of the last year. So, shout out to Tommy Warren and the rest of the folks at the City of Memphis Library for hosting us here. A few announcements, and then we'll go to the usual presentations, and also joined by a very special guest, Dr. Jain, who I'm sure has some important updates. First and foremost, I want to say to everyone, please go out and get a vaccine. That's more important now than ever. We have found new variants here in Shelby County. Some of those variants are more infectious than others, and some of them are more resistant to treatment than others. But the vaccines that have been developed, while not as effective against each one of the variants, do offer some protections, and in particular, protections against some of the worst consequences of the respiratory diseases associated with COVID-19. So we need everyone to take the vaccine as soon as they can. Vaccine appointments are available for all adults, and there's no better way to reduce the spread of COVID-19. In addition, as some of you remember, the Shelby County Commission approved a plan to create a $2.5 million fund for restaurant and hospitality workers hit by the pandemic. The fund will pay out about $1,000, exactly $1,000 grant to those workers. The relief program is being administered by the National Urban League, and they have begun receiving applications and issuing checks to those folks in those industries that have been impacted. So I'm just here to remind that there are still resources available. Thus, if you are qualified, I'd recommend that you go to the National Urban League site and make application. Again, if it sounds like you are qualified, please go to the Memphis Urban League site, which is memul.org, and you can see a slide on the screen where you might go to apply for a grant if you're qualified. This relief fund is in addition to other support programs we've built to help the industry. In fact, just this week, as part of another program, we delivered over 40,000 exclusive masks to local restaurants, which they then give away to their customers who purchase a meal or get a meal via delivery. This is our current mask. If we can get the camera back on. Our current mask that you'll get at participating restaurants is the Hustle Mask, and that's designed by Ben Collar. And Ben is not just a designer, he's also a restaurateur in town. And so if you want one of these masks, go to one of our participating restaurants, which can be found at 901jointmaskforce.com. Again, 901jointmaskforce.com. Well, we're very thankful to the various partnerships with restaurant owners and workers in our community. They have endured unbelievable hardship during the pandemic, particularly when that industry was shuttered and there was no work. Once we slowly reopened, these same workers were exposing themselves to risk every day, and every day they work to keep us on track to a safe return to normal activities. I encourage everyone to continue to support the restaurants by dining safely and ordering a meal to go. Finally, we all know that COVID has created struggles for families and households and new friction. Shelby County Crime Commission has reported that domestic violence, aggravated assaults, have been up as much as 21% during the pandemic. Increases in domestic violence lead to domestic homicide based on all available evidence. We have to do what we can to make sure the right policies are in place to protect folks and help them get away from abusers. That's why a few days ago the County Commission approved the county's first safe leave policy, which implements one of the best practices around the country, where organizations give survivors of domestic violence time away from work to address the situation. That's important right now during COVID when we've seen a spike in domestic violence. With the policy in place, survivors will have the opportunity, without putting their job in jeopardy, to find a new place to live, to enroll children in a new school, and to get help from law enforcement or social services agencies. So thank you to the County Commission and Eddie Jones, the chairman, for working to get this important policy approved at this time. At this time, I'd like to welcome to the podium David Sweat, who leads our COVID response. Thanks.
Thank you, Mayor. And I'm David Sweat, Deputy Director, Shelby County Health Department, and I'm going to go over the numbers with you and introduce the next speaker who will help us talk through some of the issues associated with the circulation of variants in our community. But right now we're at 91,130 cases reported in Shelby County. That includes 93 new cases that were reported yesterday. In Tipton County, we have 7,115 cases that have been reported so far in the epidemic. For Fayette County, Tennessee, we've got 4,791 cases reported so far. In DeSoto County, Mississippi, 20,490 cases have been reported. And in Crittenden County, Arkansas, we're at 5,500 cases reported in the pandemic so far. As far as deaths here in Shelby County, we are up to 1,567 reported deaths from COVID-19 disease. And in the vaccine front, we have administered through our vaccine campaign here in Shelby County 306,679 total doses. And there have been 207,790 people who have been vaccinated with one dose of a two-dose series. And 98,889 people are now fully vaccinated either by receiving two doses of either Pfizer or Moderna vaccine or a single dose of J&J or Johnson & Johnson vaccine. So we're approaching the 100,000 mark in terms of the number of people in Shelby County who are fully vaccinated against COVID-19 disease. Now, the biggest development that we've had over the past few days is the detection in our community of a small number, 4 cases, of people with the P1 strain, which is a new variant strain. You know that we have been talking a lot over the past several months or several weeks about the strain from the United Kingdom, the B117 strain, and that is the strain that is approaching dominance in our community. By the middle of April, it should be the most commonly encountered virus in our community is that strain from the United Kingdom. But this new strain, the P1, is a strain out of Brazil that has some other properties. And Dr. Manoj Jain will come and discuss with us the infectiousness and the dangerous issues associated with P1. But the thing that I want to remind everyone is that the standard precautions, wearing the mask, maintaining social distance, washing your hands, and not gathering together in groups of people without wearing a mask and giving an opportunity to share the virus, all of those precautions that we have been preaching about from this podium for the past year are effective regardless of the strain of the virus that we encounter. And we still need, as Shelby County residents, to maintain all those basic infection control measures, just as we have been doing. And as we continue to vaccinate more people, that will give us additional assistance in fighting these strains. But we are certainly not out of the woods yet. And with that, I'm going to invite Dr. Jain to the podium.
Thank you, David, and good afternoon, everyone. It's been a very long year, and I know that we want to be done with the virus, but unfortunately, the virus is not done with us. I want to go through a series of questions from where we are in the pandemic nationally, locally, the science of the variants, and then talk about what we can do about this. So, where are we at the national level with the pandemic? You see, the curve has been coming down overall, but we can see states such as New Jersey, Michigan, New York, where the curve has gone up. What is happening locally is that our curve has plateaued for the daily number of cases, but we are beginning to see signs of that curve going up again. And it is very likely that this will happen as it has done in other states. Now, what is causing this curve to go up? Well, in large part, it's the mutant strains, especially the B117, the UK strain. And what we can see is that this strain is causing the new cases to increase. Let's talk about the new strains and what worries me the most. Really, there are two major strains that we need to be concerned about in Shelby County. One is the UK strain, and that is making up a predominant number of cases. We've been testing for these mutant strains through the sequencing process, and what we have found is that the B117 UK strain is making up over 30 to 50% of the positive cases. But as David said, there's another strain, the P1, which really concerns us. And I want to go into the science of the P1 and the B117 UK strain. So what do we know about these two mutant strains? Well, let's talk about the B1, and let's talk about in terms of how transmissible it is, and let's talk about in terms of what it does in terms of mortality of disease caused by that. We know that the B117 is more transmissible, 50% more transmissible. And we know that the vaccines are very effective against it, and it does increase mortality. What about the P1, the Brazilian strain? What we know, it is highly transmissible, meaning it's 200% more transmissible or twofold greater transmissible than the original virus. So it can create havoc very quickly, as it has done in many cities in Brazil. There's another trait to this P1 which is worrisome, that it can evade the vaccine, and also if you've had previous infection, it can cause reinfection. So we're still learning a lot about this, but that concerns us because those people who have had previous infection and those who have had that vaccine could become infected again. But the data also shows that the vaccines are protective against severe disease and hospitalizations as well. We don't have all the clear answers to that, but what we want to do is to make sure that we understand that the Brazilian P1 strain is something to be concerned about, and there are only a few cases, and we're working very actively to contain them. Now, the science behind this also has to do with how the virus moves through a community. It becomes seeded, then it becomes clustering, causing clusters, and then it becomes a community transmission. The two strains are in different stages. The UK B117 has already caused community transmission. About 50% of the cases that are positive are of that strain. In the case of the P1, it's barely seeding our community. And so this is a time that we can act rapidly and contain it. In more depth, the science, there are certain mutations, especially this E484K mutation. Sort of the scientists call it the EEK mutation, and that's what allows it to evade a previous infection or a vaccine. Now, lastly, I want to finish up with what we can do about this and what is being done. The most important thing, as you've heard, is vaccination. The vaccination will protect you and your family against the B117 and to a certain extent the other strain as well. Continue masking. We know that masking is incredibly effective in reducing transmission. Also, testing. We've really dropped the ball on testing recently. We were doing very good on a large number of people getting tested. And then at the hospital level and the clinics, continue to do sequencing. We have built the capacity to do sequencing of nearly every positive strain in our community. That's really unique to Memphis. And lastly, tracing. The health department has a priority team, and they're actively tracing the mutant strains. There's a collaborative that's formed, collaborative between the doctors, such as Dr. Ben Andrews from the Christ Community, Dr. Jeff Warren and others, Dr. McCullers, along with the hospitals, Baptist, Methodist, St. Francis, Regional 1, along with the lab directors, Poplar Healthcare, AEL, Compass, UT, as well as the health department. We're meeting every Monday, Wednesday, Friday to actively chase down these mutant strains. So with that, I'll finish my remarks. I want to reassure that everything that we can do is being done to make sure that these mutant strains are kept in contact, in containment as much as possible. So I'll pause with that.
13.
Hi, good afternoon. There are reports around the country that we may be experiencing a fourth wave of the coronavirus. So my question is, why was the decision made to shut down the city's vaccination sites for 4 days this upcoming weekend, especially because, you know, it is a holiday weekend and a lot of people may be off and they have more time to get the vaccine during that time?
So I'm going to ask Doug McGowen, who's here from the city, to answer that.
Thank you, and good question. So the original decision was based on the fact that we would be out of vaccine by Thursday night and waiting for our next shipment of vaccine to arrive early next week. So we had a weather day on Saturday, so we are evaluating the amount of vaccine that we have, and our commitment remains and will always be to put as many vaccines in arms as we can, as quickly as we can. When we have vaccine available, we will do that. So we're evaluating how much vaccine we have on hand and how many sites we can open, and when we might be able to open those based on the availability of vaccine.
Okay, so my follow-up question is, so you may be open some of those days, depending on how much you have?
Right, so we're doing the inventory now. We've added additional appointments this week, and so we'll see where we stand about the end of the day tomorrow, moving into Thursday to determine what we'll be able to do.
Brad Broders, Local 24.
Thanks. My first question, Doug, if you're still up there, I know you had high expectations for the demand last Thursday when the appointments went up for Friday. What's your reaction so far with some of these slots open? I don't want to put words in your mouth, but just what's your overall reaction so far this week?
Well, we're pleased that when we put the word out about availability that people are responding to fill those vacancies. So I can't attest to the pace at which they're being filled. We know that very early on in the pandemic that people, as soon as we put appointments up, people filled them. So whether it's people just deciding that there will be plentiful vaccine coming down the road, they're taking their time, and or whether they're just not aware of what's online. One point I will make is that oftentimes we open up the vaccine appointments on Friday, and if people look and see the vaccine is filled, they may not go back. We do add additional vaccine appointments as we get new vaccine coming in. We may reopen more appointments at a particular site. So I would encourage folks to revisit the site on a regular basis if you're interested in getting a vaccine, and we encourage everyone to get a vaccine.
Thanks, Doug. And as my follow-up, this is probably for Dr. Jain or David. I know the transmission rate is now above 1. COVID Act now said it was at 1.15, which is the fourth highest in the state right now. I guess my first, it's kind of a twofold. With the cases, are you concerned we're about to be at a potential tipping point with this P1 and the B117 strain? And can you elaborate a little more on what we know about the vaccine efficiency with the P1?
Okay, so thank you, Brad. I will answer part of your question, and then I'll ask Dr. Jain to also comment. As far as the indicators, the things that we follow and monitor, we are back above 1 for the reproductive rate of the virus, which we call RT. So at 1.05 or 1.15, depending on how it's being calculated, either way, we're above 1, meaning each case is creating more than one additional case right now in our community. In other words, we're growing the epidemic. We also have seen 3 other indicators that although the numbers are still low, they have changed direction. For most of 2021, we've been going downhill. We've been shrinking the future, but in other words, improving our indicators. But right now, our positivity rate bottomed out at 3.3%, but it's back up now to 4.3%. So a full percentage point gain in the past 4 weeks in positivity rate. We've also seen that the number of people in the hospital, which had been declining consistently for some time now, has plateaued and has actually started to increase once again. And that's important not only for Shelby County, but for the surrounding area, because our hospitals serve Western Tennessee, Eastern Arkansas, Northern Mississippi, even Southeast Missouri, and Western Kentucky. So we are seeing the number of people hospitalized starting to go back up, and the number of people in the intensive care unit is starting to go back up. Now, does that mean we are headed into a fourth wave? It's too soon to say. That is something that we are concerned about, though, and what we are seeing occur in many communities. As Dr. Jain already mentioned, across America, the number of cases are going up. If you saw the comments of the head of the Centers for Disease Control, Dr. Walensky, she is very concerned about the fourth wave. But here locally, we're not quite there, but we are certainly seeing some indicators going up again that had been improving for the past several weeks. And Dr. Jain, do you want to come talk about the vaccine?
So adding to what David said about the tipping point, it's hard to tell. But the fact that we haven't continued the decline that we were seeing and that we saw the plateau means that there is a real tug of war between the virus wanting to spread and us getting people vaccinated and continuing to mask. Now, let's talk about the vaccine efficacy and the mutant strains. First and foremost, the UK strain, which is a predominant strain, the vaccines work perfectly against those strains. They are 100%, as far as we know, protective. Now, that is the predominant strain that we're seeing here and in our county and in America as well. The P1 is just a rare few cases that we have found because we have done aggressive surveillance. Other communities aren't doing that level of surveillance. And then once we do that surveillance, we find those cases and we contain them. The P1 does show a level of resistance with the vaccine. Now, how much, we don't know, but we do know that with previous infection as well, that mutation that is there, the E484K mutation, that allows it to evade the vaccine and those who have had previous infection. So the efficacy is reduced possibly by 50% by some calculations done theoretically, but we haven't seen it on the ground yet.
Kelly Roberts, WMC.
Good afternoon. I guess an obvious question for this week, and especially when talking about this potential for a fourth wave, or at least the presence of these variants in the community. Easter, obviously a very gathered, focused holiday. What locally, as health officials, what do you want people to know? I mean, especially about in-person, faith-based services.
Sure, so I can start with that and I'll have David add to this. I'll tell you what we have done as a family in getting together. After all of our family members, extended family members were vaccinated, we got together and we weren't wearing a mask. And that was delightful. It felt really, really good. So what I would encourage people of faith communities who are getting together is get vaccinated and then plan on getting together in person without a mask. So I think vaccination is the key for us to be able to bring life back to normal. On other occasions, continue to mask. Do not think that we are out of this yet. Masking really helps, makes a difference, and prevents this. I can tell you from patients that I see, those who continue to mask are really protected. David, would you like to add?
So thank you for the question. And yes, we're in a number of different religious holiday seasons right now. Of course, there's been Holy, there've been the Passover. We're coming into Easter. It's a time of celebration, and certainly vaccines make it possible to be a little more relaxed in those celebrations. But when there's a number of people getting together who are not all vaccinated, or you don't know whether someone else is or isn't vaccinated, or you yourself are not yet vaccinated, there's a few things that we can do to make the situation safer as you observe the religious holiday you're observing. First, outdoor services are much safer than indoor services. Indoor spaces make it easier for viruses to float around the room in an enclosed airspace and be picked up by somebody else, whereas an outdoor event, such as a sunrise service, the wind can carry the virus away and it's not going to be enclosed. So that's one thing I would say, is have as many gatherings outdoor if the weather's good, to take advantage of the good weather. But the rest is to vaccinate and to maintain masking and social distancing. So if it's not a situation where it's going to be outdoors and it's a mixed group of people, some vaccinated, some not, everybody needs to wear the mask and spread out, still maintain social distancing, wash your hands frequently, all the normal things. Those are the things we would recommend that people do. Now, one thing I will mention, and if you want to check this on the website, one of the requirements that the health department has had for some months is that if there was a gathering or an event, somebody had to present a plan and get it approved by the health department. That has been changed a little bit. If it's a small gathering involving not a lot of people, all we're asking is you just look at the health directive and follow the health directive, and as long as you're following the guidance there, you don't have to get our approval for your event. But if it's a very large event that is difficult to manage, or if it's a situation where somebody has been closed for unsafe reasons and they need to reopen, in those instances, it's still important for a plan to be submitted for formal review by the health officer and others. But if you're curious about a gathering or an upcoming event, go to the website at shelby.community, follow the instructions to determine whether or not your particular event needs official approval, or you just simply need to adhere to the health directive guidance.
I don't think I have a follow-up.
Jane Roberts, Daily Memphian.
Oh, as more and more of the Johnson & Johnson vaccine comes into the community, can you talk about the plan for how it will be used? And I have a follow-up.
Okay, I'm going to invite Chief McGowen back to the podium.
Thank you for that, Jane. Yes, we will begin receiving more and more J&J. The couple of principal focuses. Number one, for people that are hard to reach, the homeless and homebound population, just using the J&J's a much easier medium to work with. It's more stable than as you're transporting it around. The other vaccines have only a few hours of shelf life once they're opened, and the vials are actually drawn up into the syringes. So that's a principal focus, is homebound and homeless populations. We are also using it in many of our community-based pods that are in partnership with churches, where there may be some vaccine hesitancy and we worry about the uptake of a second vaccine. And so we have a number of community partners who are already slated to begin those community pods over the next few weeks, and that is our principal focus for getting the J&J out. I do want to say that many of our 60-plus providers in the community, that is the pharmacies, the dialysis centers, the doctor's offices, the community-based clinics, are also requesting J&J, and as that comes to us, that will be distributed out to those partners. So again, it is not just through the community-based pods, but through many, many partners here in the community where you can receive a vaccine, and J&J will become one of the choices that you have during that selection process.
My follow-up, Doug, is if people want the J&J, should they watch for the pop-up sites and make an appointment there, or
All of
go
our,
to?
excuse me, sorry, at all of the sites that we have for vaccines where we advertise that on the city's website, the covid19.memphistn.gov, we will tell you what variety of vaccine is available. I would suggest that no one wait to get a vaccine. Getting their first vaccine, even of the Moderna or the Pfizer, does provide a level of protection, and that second booster shot gets you up to the 90+% protection. So I wouldn't suggest that people wait until one specific vaccine is available. They all provide protection, as Dr. Jain mentioned. And so, but you will be able to see what vaccine is available at what site listed on the website.
We are out of time. Are there any closing messages today?
Anything, Mayor, you want to close this out with anything? So, okay, so we're doing our level best to make sure that we track these variants. We're very thankful for our local lab partners who are doing this sequencing. We're thankful for the support of Shelby County government, the city of Memphis, who are funding this work to make sure that we are ahead of the curve with the sequencing. We encourage everybody to continue to get tested. There's lots of testing still available. So A, get tested before you go into the weekend. B, go get a vaccine. We still have appointments available and we have vaccine available. And we will look to see a significant uptick the week after Easter with a number of vaccines that we have available. So please, as soon as appointments become available, make yourself look on the website and take advantage of a vaccine. Thank you all.
Thanks, everyone. We'll see you back here on Thursday.